Hey guys, so I'm sorry for the glare on my glasses, but in today's video, I thought that I would share some tips that I have for rooming patients. And a lot of these tips have more to do with if the person is very talkative. But I just want to give some general overall tips for rooming patients. Obviously, I am currently working full-time as a medical assistant in an urgent care setting. So sometimes in urgent care, we have some things that need to be addressed right away. I will usually, if somebody's coming in for something like chest pain or shortness of breath, things like that, I will obviously attempt to get their vitals first, because I want to make sure that they're actually breathing sufficiently, and that this isn't something that needs to be sent to the emergency room instead of to urgent care. So um, basically, I will usually start the visit by going into the room and pulling in different information from other facilities if there's someone who doesn't normally see us. So we use the Epic software system, and we are able to use Care Everywhere is what it's called, which can pull in information from other systems that use Epic as well. So I will go in there, I'll take a look at things, unless it's something, like I said, like a chest pain or a shortness of breath, and then I will just go get the person from the waiting room. Once I bring them back, I'm getting their weight, because the scale that we have is right in the doorway from the waiting room. And so I will get their weight, and then, sorry, I have something in my eye this morning. Then I will bring them into the room. I always, the first thing I do is I make sure that I have the right person. So I always ask them what their date of birth is. Then I ask them what we are seeing them for. So I'll usually say, can you verify your date of birth for me? Or I'll say, what is your birthday? If it's like a younger kid. And then once I've verified that it is who I'm supposed to be rooming, then I will, like I said, ask them, what are we seeing you for today? Even though there are appointment notes that tell me what the person said they were coming in for, half the time what the thing says is not what they're actually there for, or it's something completely different, or it's somehow related, but not quite what they were able to explain over the phone. So I've had people who are coming in for personal reasons, and it's something like a pregnancy test, or it is they are requesting STD testing or something like that. So obviously you're not going to know what personal means. So I always ask them what they're coming in for. I would say if you have any questions about anything, ask, because that's the only way that you're going to be completely sure of what the person is there for. I always try to remain open and non-judgmental. I don't want my patients to feel that I am judging them in any way. I've had patients who get embarrassed about certain reasons for being there, and so I always tell them, it is perfectly okay to be embarrassed. It's understandable. However, we're not going to judge you. We're literally just here to help you. And of course, now the sun is going to come out and blind me. But anyways, I shall continue. So I have encountered a lot of patients who love to talk, and I think working in the long-term care / nursing home setting kind of prepared me for dealing with really talkative patients. And so I kind of let them talk a little bit, but then whenever there's an opening, I will steer them back towards the rooming process. So for example, yesterday I had a patient who was very, very talkative, and she kind of paused for a second, and I said, so what pharmacy do you use? And we kind of just steered the conversation back to where it needed to be. I will say, if you don't do those types of things, you are very likely to get stuck in the room There are some people who I work with who love to talk to the patients, and I get it. Like, you want to form a bond with your patients, but like in the urgent care setting, I don't have time for that because, like, yesterday I had 0 rooms that were urgent care dedicated. So I was stealing rooms from different providers who had openings or open rooms at the time. And so, like, I need to get them in and out as quickly as I can. Like, I don't have time to sit here and have a 20-minute conversation. Like, on the weekend, it might be a little bit different because I do actually have like 13 rooms that are completely dedicated to patients. I've never used all 13 rooms, by the way. But if I needed to, they're there. So yeah, definitely if someone is very talkative, steer them back towards the rooming process. Like, you have to find a way to get it in there. Oh, what pharmacy do you use? Or are you allergic to any medications? And I always ask about medication allergies, even if it says that there are no known allergies on their chart. I always ask. I will ask, like, are you allergic to any medications? Any new allergies since your last visit? Things like that. And then I will always go through, like, unless they're there for like a broken leg or something. I mean, honestly, even then, I go through, like, if it's been over a month since they've been to us, or if they've never been to us before, I go through medication by medication. Are you still taking Prilosec? Are you still taking fluoxetine or Prozac? Are you still taking Seroquel? Like, I will go through the medication list that we have just to make sure that it's up to date. If they are a patient who we see on a regular basis, because we do have a group of patients that we see in urgent care on a consistent basis, or if it is a patient that is seen by one of the providers in our office, I will ask them, like, if it's been within a month, I will say, have you had any medication changes since the last time you were seen? If the answer is no, then I leave it exactly how it was the last visit that they had. If they say yes, then I will update it. And that's just kind of how I do things. I do also, because I work urgent care and there are different providers there on any given day, I will let them know before I leave the room, like, hey, you'll be seeing so-and-so today. If they are new to our practice, like they've never been to our clinic before, I will say, you're seeing so-and-so today. He or she is a nurse practitioner or a physician assistant or a doctor. That works for us, and they should be in a minute, or they should be in shortly. Just let me know if you need anything while you wait, something like that, just to give them an idea of how long the wait is going to be. So like yesterday, I felt bad because I had to have people sitting in the waiting room for a longer period of time than what I would have liked. But like I said, I had no rooms dedicated to urgent care patients yesterday, so I just kind of had to pull people back as I was able to. And I was glad that we weren't super, super busy yesterday, because it would have been a shit show, literally. But anyways, I just thought that I would share that with you guys. If you guys want any more tips as far as medical assisting goes, I would definitely love to share my tips and tricks and different things that I have learned in my time as a medical assistant. I've been a medical assistant since 2021. I have been working here full-time, part-time, per diem since March of 2023. And I am now, like I said, working full-time in the urgent care setting again. So that is it for today's video. If you guys have any other questions or any topics you'd like me to discuss on my channel in the future, let me know, and I will talk to you guys in my next video.